It is my pleasure to welcome our Honorable Speaker of the Day, Dr. Shikha Sharma. I also welcome all the dignitaries, faculties, teachers, students and staff present here. Yogastha Club and IIT Bombay Sports Council are extremely happy with your presence for the second lecture of series on wellness. The topic of today's lecture is how to build a core human health, the four muscles, the physical, the emotional, the cerebral and the spiritual. Now I request the convener of Yogastha Club IIT Bombay to felicitate Dr. Shikha Sharma. Dr. Shikha Sharma is a medical doctor. She is founder and managing director of Nutri Health System. She has a weekly column in one of the leading newspapers of our country, the Hindustan Times. She also regularly appears on television channels. Dr. Shikha has been honored with prestigious awards like the Women Achiever Award by FICC, Great Indian Women Award by Modern School, Women Achiever Award by Bharat Nirman Society, Service in Preventive Healthcare Award by the Honorable Union Health Minister of India. I now invite our speaker Dr. Shikha Sharma to give a talk on how to build a core human health.
Firstly, I'd like to thank all of you for giving your time and coming over here. So, I have been asked to speak on health. I'll first quickly try to tell you a little about my own journey, and then after that, I'll talk about health. So, I passed out of Maulana Azad Medical College, as was stated in my bio. When I passed out of medical college, I did my mandatory internship and then residency in the Panth Hospital, which is basically a super specialized hospital in heart and neurosciences. So I was posted in the cardiology department. And I must be, 21? When every day when I would go to the ICU, I would see one death. So I think during my entire period I spent in my house job, I must have seen, I think, many deaths. That left an impression in me because as a doctor I knew that by the time the patient comes to us, the patient already has a severe damage to the heart. The arteries are blocked, the heart muscles have become weak, the lung has become weak. So what we salvage is something which has already been damaged a lot. And that somewhere subconsciously I started thinking that what could have been done at an earlier stage before the patient was brought in a critical condition. There was also a sense of personal failure, thinking that all that medicine I learned, really, what does it amount to if the patient is going to die because of a simple thing that they did not understand how to take care of their health. And as doctors, are we doing justice? Or rather, as me, will I be able to do justice if I'm not doing something at the right time? So that stayed in my subconscious level. And of course, as I went forward, I really did not know what I wanted to do. So I was not clear. Of course, the correct path for most doctors, and especially the doctors from MAMC, more than 50% go to US or UK because of the higher infrastructure, the better facilities available in these countries. But I wasn't clear what I wanted to do. I thought I'll go there, but I wasn't clear. Over a period of the next few months and years, the thought started emerging, which was becoming stronger, that I want to work in preventive healthcare. But preventive healthcare is not a big field in medicine. It is something which you just do to write, columns and papers and stuff. It's not really practiced to that level. It's a very theoretical thing. It's not applied very well. So I wasn't sure what is my career going to be in preventive healthcare. But slowly, I think subconsciously, the intention to be in preventive healthcare was becoming stronger. Now I'll fast forward to my first clinic, which I set up, and that I set up accidentally because somebody asked me to set up. And it didn't do well. It failed actually. And I realized that sometimes what you want to do for people, they may not be ready for it. They may not like it in the flavor you're giving them. So preventive healthcare in its original flavor didn't appeal to people. And while talking to my own patients, clients, I suddenly realized they were more excited about weight loss, weight management. So all I had to do is I repackaged the preventive healthcare as a weight management solution. And suddenly I had so many clients. Now, so after the first failure which I faced, and it was interesting because I'd never failed in my life. I was one of those goody students. So I used to sit in the front benches. I used to finish my homework. And I had never failed in my life really. And my first failure was in this new venture which I was wanting to start in preventive healthcare. And obviously when you have never failed, you take failures very badly. And I took it very badly because I did not know what had hit me. How could I fail? And I started getting hungry for information, that why had I failed? I started studying marketing, business. I even joined a business school, but I couldn't complete it because what happened in between was that I got my courage to start again. And this time when I started with a more clear focus on patient. So from the focus, which initially my focus was what I want to do. Now the focus shifted to what the patient wants. I think that was an important change. And now my work started growing. It kept growing and growing and growing. And then I had reached a point where I remember distinctly I was sitting with a very senior doctor in Delhi. I'd gone to his office, his hospital. We're discussing something. And I get a call. And this was around 5:30. And the caller says, am I talking to Dr. Shikha? I said, yes. That a patient wants, a very important a person in the government wants to consult with you. And can you give time tomorrow? I said, no, tomorrow my appointments are fixed. I'm not sure. They said, and also you have to come to this person's house. I said, I don't go anywhere. I'm so sorry. The patient has to come to my clinic and I'll see him. And anyway, tomorrow I'm busy. They said, sure. If tomorrow you're busy, then you see him today. I thought this was really being imposing. I mean, how can you insist that you will see the patient today? Anyway, I said, today is impossible. I'm sitting in another doctor's office and I don't think I'll finish in time. They said, no problem. Whenever you finish. Anyway, the call disconnected. After about 10 minutes, a call came again. They said, and there was another voice on the call now. And the person says that, am I speaking to Dr. Shikha? I said, yes. I said, we had called you earlier. My office had called. And I would like you to come today and see this patient. I said, excuse me, sir. I do not come. I do not go anywhere. Let's discuss this tomorrow. They said, no, it's very urgent. And you will have to come. And this is a very, very senior person in the government. Very important person in the government. I kept quiet. I was thinking, who's this? Then again the call came. The third time I said, look, I think I'll have to think about it. They said, no, you please come today because after that the person doesn't have time. And I said, okay, I'll check with my mom because now I'd run out of excuses. And the other person, there was a pin drop silence and they said, check with your mom. Is it Dr. Shikha? I said, yes, this is Dr. Shikha. And he said, you won't regret this. Trust me. I will send the car today at your house. We know your house number and that really surprised me. We know your house. We'll send the car. So I went home and discussing this. And then I see 2-3 police jeeps coming in. I see a car with no number, just the emblem of Government of India coming in. And that's the first time I realized that I was going to the Prime Minister's house. And I was like, oh my God, self-doubt hit me. After that, fear hit me. I said, oh my God, he has access to the best doctors. Why does he want to talk to me? I don't know enough. And suddenly between self-doubt and fear, panic hit me, because now I was panicking that I hope I don't make a fool of myself going to the Prime Minister. And what will I say to him? I don't know anything about his medical history and whatever. So anyway, I was taken, and my family said, okay, we want to go along because it's now late and we want to be with you. So we all trooped into that car and landed at the PM's home. So that whole experience was unreal for me. But what happened after that experience was, I realized that I was not looking at the big picture. I was just looking at myself and my growth and what I can do and my small problems. I was not really looking at the big picture. I was not looking at what the opportunity meant. If the Prime Minister of the country is looking for health advice and he's serious, then imagine the actual need in the country for preventive health care. Imagine the kind of issues which are top-notch people face when they're at the peak of their career and their body is not cooperating. They are not feeling healthy. And from that day, I decided that I have done my first thing which I wanted for myself. My first goal, it was not even a goal. It was the normal stuff, what we all desire. I said, I should just forget about myself, and now I should concentrate on what can I do for this field, for the field of preventive healthcare. And that's the time I think the goal became much bigger than myself. Now, over the next few years, I transformed from a private practice into building an institution. It became harder and harder and harder. And to give you some examples, that from medicine, I had to suddenly learn about people management, about finance, about marketing, about branding. So the whole landscape became much bigger. In this entire journey, my own health started suffering. Was it due to hard work? No. My health did not suffer because of hard work. And that's why what I want to share today is what exactly is health and what are the kind of things you will experience as you go ahead in your life and your career, and how are you going to build your health. So let me first begin by, let me begin by an example. When we start learning how to drive a car, we usually learn in a park or on an easy road. But can you really think that we are driving a car in a park or in a ground or in a Maidan? Is that really driving? That's not driving. The real driving happens when we start driving in places which are congested, where there are no rules. Anybody can come from any side. Somebody can hit your car. A police wala can say, "Ye kya hai? Fine do." And you say, "I didn't do anything. Fine do." So what I'm saying is, this is the reality of life. The reality of life is that when you're driving your car, you're going to be hit by other people who make mistakes. You're going to be fined for things you have not done. You are going to have breakdowns because you were concentrating maybe on the road and you forgot about some part in the car which required maintenance. So when this car, which is yourself, you're driving and navigating, there are going to be a lot of issues which will come in front of you. So health basically is not damaged just because we didn't eat something or we ate something. Health is damaged because of emotional problems. Health is damaged because of intellectual and the problems which we create because the way we think. Health is damaged because of several reasons. So what I will talk about today is that in this journey of life, your best friend is your body. And why I'm saying your best friend is your body is because that's something which is going to take you through this journey of life. And there are 4 muscles in the body which we have to build. The first, and the muscle which we see very clearly, and therefore we think this is all it is the physical body. So, your physical strength. When you have to build your physical strength, in your 20s, physical strength is a given. But in your 50s, physical strength is not a given. You will be surprised by the kind of changes which happen very rapidly between 30 and 40. And how quickly the energy goes, how quickly the metabolism changes, how quickly the liver becomes fatty liver, how quickly there is hormonal change in your body, and you'll be shocked how your body starts changing and you don't even realize. So the physical muscle is the first thing you need to build. And when I say about the physical muscle, first is basic stamina. You'll be called for basic stamina in your life. Your basic stamina to last out. Physical stamina. It could be small things, walking. There will be times when you may be doing a project in some country, you'll miss the last bus, you'll have to walk. And if you don't have the physical stamina, you'll be in pain. So physical stamina is, second thing is flexibility. I see so many CEOs at the prime of their career, they have a slip disc, and then the doctors tell them, don't fly, don't walk, don't run. They almost become invalid at the peak of their career because they had a slip disc. So, meaning that the basic muscles which control your spine, they have to be strong, otherwise they will not support your spine and there'll be a slip disc. So, your core muscles, your abdominal muscles, when your core muscles are not strong, your body parts inside do not function well. Your core muscles support your body muscles. Your core muscles support your spine. So the spine is an S shape. So it's supported by the muscles on the side. And it is supported by the muscles which are the core muscles in the front. So when your physical muscles are deteriorating rapidly, because it could be lack of exercise, bad posture, it could be lack of nutrition, you start feeling it. Little aches and pains, little stiffness, and boom, one day, when you least expect it, there is an event. The second muscle which I will talk about is your emotional muscle.